As COVID-19 surges across the country once again, Dr. Anthony Fauci now says the Omicron variant will, quote, ultimately find just about everybody, unquote.
This comes after our next guest warned we are facing what he's called a viral blizzard. He's bringing out the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, Dr. Michael Osterholm. Good to have you back here on the program. Give us an idea. I think you actually use the word breaking when it comes to our system here, our hospital system and our hospitals that are being overwhelmed. Not just bending, but breaking. So give us, beyond that word, give us an assessment here of how our healthcare system is doing right now in this current surge.
Well, we actually have a perfect storm occurring where, number one, we have seen this onslaught of patients coming in needing hospitalizations. Today, we are about to exceed the highest number of hospitalizations for COVID that we've had at any time since the pandemic began. That includes an ever-increasing number of individuals in the intensive care units. Our medical facilities around the country, all 50 states, are stressed. But that's also occurring at the same time that up to 20 to 25% of healthcare workers are become infected. You just announced earlier this afternoon, in fact, one of your own who is a medical doctor who is infected. And that is putting incredible stress on the system in addition to the number of patients. Healthcare workers have been hanging on largely by the skin of their teeth, trying to provide care. Now with this surge and up to 20% of them off work because of their infection, we are seeing healthcare systems out there not bending anymore but breaking.
In your op-ed, you wrote, a recent one in the Washington Post says, it's time to acknowledge reality. Many schools will likely have to close because of Omicron. And I talked to a doctor not long ago. She was with the, Pediatric Association, who actually said, you know, I don't have a scenario when it comes to COVID cases that I would suggest a school shut down. Schools are shutting down now because of staffing. So what, in your opinion, is a safe school when it comes to our kids? And is your argument more so staffing as well? Do you not think there's a high enough risk necessarily to the kids? It's just a matter of Omicron is causing all kind of havoc when it comes to staffing.
Yeah. Well, first of all, there is no safe school for any kid with Omicron, okay? But there's no safe place anywhere, whether it's at home or school. They are safer places in terms of limiting transmission, but I worry that the rhetoric is that somehow there's this absolute magical wall around these kids when they're in schools. As you pointed out, and the point that we've been making all along, how safe is a school when basically you're just trying to provide babysitting service for these kids because you can't teach? You don't have enough teachers in the classrooms to teach. And we're hearing from many, many school districts, the challenge is not just the kids. They want kids in school. It's the fact you don't have teachers, support staff, or bus drivers to actually hold school. And again, this is going to be short term. This is not months and months of what we're seeing here. And so we just, like a real blizzard, when we shut down for a blizzard, does anyone say, no, we must send our kids to school today? And I think this is the same situation here. For the next 2 to 3 weeks, we are going to have challenges. And if a school can open with enough teachers, go for it. But right now, that's a challenge in many communities throughout our country.
I want to talk a little bit about this potential fourth dose of the vaccine. There are some who are immunocompromised that will be eligible for that second booster shot starting this week. But you have been hesitant to recommend that for the general public. Tell us why. What are your thoughts on that?
Well, first of all, I very much support getting the 3 doses. I think that's a very important point, and I very much support getting the 4th dose for those who are immune compromised. But what this is really begging the question of is as remarkable as these vaccines are, and as we know, if you are fully vaccinated with the 3 doses and or 4th dose if you're immune compromised, you get amazingly good protection against getting seriously ill, hospitalizations, or deaths. But the question arises, are we going to expect our countries to each and every 6 months vaccinate people again and again? That's not going to work as a matter of practice. And so we need to go back and look at just how do these vaccines work? How do we best use them? And frankly, as remarkable as they are, we are going to be talking about a COVID vaccine 2.0, 3.0, and 4.0 in the future of how can we improve on these vaccines. So it's not that I'm against protecting people. It's the matter of we just can't deliver vaccines every couple of months to the whole world.
We didn't need you to make that clarity that you're not against protecting people. We know that's what you do for a living, Dr. Osterholm. So we appreciate you once again coming on here to our program and sharing your thoughts and your expertise. And we'll see you. Have a good weekend, all right?
Thank you.
Well, hey. Hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.